I've seen plants close and a lot of businesses close and things change, double-digit unemployment, and worse than what it had been through the 80s and 90s.
Monroe County right now has the highest unemployment rate in the state, and recently we've had a lot of issues going on. We had a Ormet aluminum plant here that was the biggest employer in the county that went out of business here a couple of years ago. We have coal mines, the other big employer in this area, and just last week we had 100 people permanently laid off from the coal mines here and another 1,300, I think, on a temporary layoff.
A lot of people in this area lost their job, and that was very hard for a lot of people in here, and I did see a spike in our clients that came.
Well, we had 2 plants down the riverfront, but they both shut down. They're now like a terminal. They have little businesses coming into it and stuff. It's starting to crank back up.
Some is generational, that just their family and how they've grown up, and either because of education or jobs or whatever they've had, that need has maybe been generational.
People who think who've grown up in poverty in this area, and they, for whatever reason, lack the ability to, transportation or whatever it is to get to the places where they need to improve their situation. And I'm sure there are lots of people that would love to go to work and things, but they just don't have the transportation and things to do that. The total package of poverty, affects all areas of people's lives, healthcare, transportation, like I mentioned before, education, lack of opportunities to change their situation, and I think there are issues that go along with that, addictions and illnesses that people can't get treated and things like that. So that all just kind of combines, I think, to make the hunger issue worse in some situations where they can't really get out of that cycle.
Lack of money to buy the extra groceries. I mean, when you only have so much money, and especially if you don't have kids and that, if you go to get food assistance from the welfare, you don't get enough to make it through the month.
We have a lot of families that have blended families, which means 6 kids might live with mom and dad, and there's 4 that live there full time. Well, they're only getting maybe benefits for those 4 children that live with them, but the 6 kids come for the whole summer.
There's always some that slip through the cracks. Some we can't help, some don't want to be helped. And with a lot of the programs we work with, there are income eligibility guidelines. And sometimes that federal poverty rate, it can be a crusher. It can be hard on the eligible people that they need help. They're too proud to ask for help, and they finally get around to opening up and say, yes, I need help, and then they're still not in a bracket where they're income eligible, and then you have to say sorry.
I like to see the seniors come in. It's really helpful for them, because a lot of them probably their income, if they lived here all life, they didn't have a good job, their income is not that much and everything, but they survive.
With medicine and everything, on doctor trips and that, there's a lot of things we cut out. We haven't been on a vacation for probably 40 years.
I know they're struggling. I know health care is a huge issue. I know they're going so far as to cut their pills in half. They're literally cutting their medication in half and squeezing it by, which is not working really at all. It's probably doing more harm than good. They're just halfway doing it, so to speak. But in order that they can get more groceries.
Their income is not going to change. A lot of times it actually gets worse. Sometimes we have people, veterans, a lot of veterans, that are trying to get their benefits and are struggling to get them, and they need help. So we're there to help them with the little bit that we can. Food, personal hygiene items. I mean, we try to cover it all in the pantry.
The churches are always involved. And then you have the Kiwanis and the Masons and Ruritans and groups. You have your civic and church groups, I would say, are a huge part of that. And then community action, Mid-Ohio Food Bank, DJFS, and a lot of your social service programs.
SOMA is the big one that runs the food pantry here. There is another food pantry in Louisville, and they actually do a produce giveaway and things on Saturdays, which is very helpful for people. Of course, the availability of SNAP benefits is another major thing that helps people here in the county. We do have a senior meal site where the elderly can go and get meals at the senior meal site. And we do have a large percentage of kids in this county that qualify for free and reduced lunch, so that's a big help to them as well as when school is in session.
GMN is a huge help to Monroe County. They help 3 counties surrounding us. Churches always try to help out. They have little small pantries that if somebody comes in and needs food, they're able to help them a little bit, and they direct them to the food pantries that are larger to help them.
Salvation Army, Emergency Food and Shelter, there's United Way. So there's a lot of groups out there that have hearts as big as Texas and the right frame of mind and are trying to help.
And we started kicking around how we might be able to put together a mobile food unit, because sometimes in this county, what's really tough is we have the food bank here, but there are a lot of people out in the county that can't get here.
And we see anywhere from young people who have young children to elderly people, and anywhere in between, people with large families, people that live on their own. There's no one particular type of person, I don't think. And some people are facing hunger that they wouldn't really think if you just saw them out on the street.